Hi, I'm Dr. Ashlea Broomfield and I'm a general practitioner at Tormina and Sawtell Medical Centres. I'm here today to talk to you about the role that GPs play in managing adolescents and their health issues. As children become young adults, they start to face a host of different challenges. A lot of people might see GPs as someone who only deals with coughs and colds or ankle injuries. But in fact, GPs have lots of skills that help them to manage the things that come up in adolescence in terms of health problems. These can range from sexual health, mental health, to drug and alcohol issues and much more. In order for GPs to help adolescents, it's important that they and their parents feel comfortable in approaching us. And so there's often a range of different questions that parents and teens feel like they need answers to, which we're going to talk about today.
Can my teenager make a doctor's appointment without my consent?
So teenagers or adolescents are able to make appointments with their general practitioners without their parent consenting for that appointment to occur or the parent attending. So it is possible for a teenager to call up the medical centre and make an appointment for themselves. It's really important that even if you do come along to an appointment with your adolescent, that you have some time, that the adolescent has some time with the doctor on their own to discuss their own health issues. The reason for that is that there's a lot of things that adolescents don't feel comfortable talking about in front of their parents, like sexual health. So many adolescents don't feel comfortable talking about sex in front of their mum and dads, but they're things that are really common that doctors need to talk about. So chlamydia is a sexually transmitted infection that's really common in people aged 15 to 25. In fact, about 10% of people between 15 and 25 get chlamydia. Chlamydia can cause infertility if left untreated and is really easily treated with 2 antibiotics in a single dose. So if the young person doesn't feel comfortable talking about sex in front of their parents, then being able to have a relationship with their GP, the GP can provide adequate treatment and adequate health advice and education, like safe sex education.
Will my doctor tell my parents if I'm having sex?
Every person is entitled to patient-doctor confidentiality, and this includes adolescents. So anything that is said to me in my room without anybody else present is confidential. What that means is that I can't tell anybody else what a young person tells me and that they've told me that outside the room unless they tell me that I can. That means that if you tell me that you're having sex or that you tell me that you've been drinking some alcohol or smoking cigarettes, that although I'll give you appropriate health advice as to how you can better protect your health and how you can better manage your health, that I'm not actually legally allowed by law to tell your parents that that's the case. There are certain situations, because you're not yet an adult, you're not yet 18, where I sometimes will have to speak to other people about your situation, and that's usually if you're going to hurt yourself seriously, you're going to hurt somebody else seriously, or somebody else is really hurting you seriously, and then I'm obliged by law to actually, in your best interest and protect you, to tell other people. Most GPs will not tell other people without actually talking to you first and letting you know that that's going to happen.
How do I pay for an appointment if I book myself?
Here at Tormina and Sawtell Medical Centre, we bulk bill everybody under the age of 16 when they come to visit a doctor for their healthcare. If you're over the age of 16 or you're visiting another practice, you can talk to the reception staff to discuss how you will pay for your appointment and whether there will be a gap fee in place. From the age of 15, everybody is eligible to get their own Medicare card. It's important to discuss this with your parents to get this set up because it's a really good step in managing your own health for the future. If you don't have your own Medicare card or you're unable to find a Medicare card from your family members, then our staff are usually able to find this out through Medicare Online anyway.
Should my teenager have her own doctor?
It really depends on the adolescent. What matters most is that the adolescent has a really good relationship with their GP. Some teens would like to move away from the doctor that their parents also have or that they used to see as a child. Others may have a really strong relationship with their GP and prefer to stay with them. We suggest that you talk to your adolescent as he or she starts to move into adulthood and help them to start making some of their own health decisions, which includes finding a GP that they're really comfortable with.